This is the information about iHeart we use for the community health worker presentation, but I'd also like to make it available for steering committee members. We're looking at this partnership because there's a lot of overlapping risk factors between diabetes and heart disease. Cardiovascular disease is the #1 cause of death of people living with diabetes, and this results in 2/3 of the deaths of people that have type 2 diabetes. So what is iHeart? iHeart stands for Indianapolis Health Equity Advocacy Outreach and Treatment, and it's sponsored by IU Health. It's out of their Office of Health Equity Research and Engagement and part of their Community Health Outreach Program. It focuses on cardiovascular disease health as a priority condition. And as I said, cardiovascular disease is a top cause of death in the United States and in Indiana. In Indianapolis, Black residents have a 16% greater chance of cardiovascular disease-related deaths than their white counterparts. In the past, the iHeart program, which is part of IU Health, treated people once they became sick or tried to impose health practices on them without really understanding some of the unique needs of the individuals and communities. iHeart wants to work collaboratively with input from residents to understand each community that they serve. What are their needs, and to use that input to help identify unique barriers that can keep people from seeking care and can keep them from being healthy. Knowing that 80% of our overall health condition is due to non-healthcare factors, iHeart wants to work to address socioeconomic factors such as low education, job status, family support, income, and community safety to help manage chronic disease. iHeart is based in 3 Indianapolis neighborhoods. The selection for their neighborhoods was based on the high rates of cardiovascular disease. They also had high social barriers that might keep people from being able to manage their heart health. They had medically underserved groups within those neighborhoods, and they were looking for communities that already had existing active partnerships. And DIPIN meets this criteria in 2 of our 3 neighborhoods. So iHeart is working in the Northeast area and the near Northwest neighborhoods, and their 3rd community is on the South side. Other iHeart partners, besides the one I mentioned, are their Congregational Care Network and their Cardiovascular Institute Barbershop Initiative. They're also working with the IUPUI Center for Translational Science Initiative, which is helping collect and keep public health data, the Polis Center, and then DIPIN, as I mentioned. iHeart's goals and objectives are to reduce new cases of cardiovascular disease and complications from cardiovascular disease. They want to do this by increasing screenings for cardiovascular disease risk factors such as blood pressure. They also want to reduce emergency room visits and hospitalizations due to cardiovascular disease. iHeart is also using a community health worker model that they based on our DIPIN community health worker model. They have both neighborhood-based community health workers and clinic-based community health workers. And they have functions to help provide outreach to residents and to the clinic patients that are coming in, to follow up to make sure people are getting connected to the resources that they need to better manage their health, and then to provide feedback from that neighborhood and clinic level so that they can provide better clinic care. So why is DIPIN partnering? As I mentioned, there's a lot of overlapping risk factors for cardiovascular disease that are similar to the ones that we work on for diabetes. So similar actions can be taken to decrease the risk factors for both of these disease conditions. Both iHeart and DIPIN include community health worker interventions, and we're working in overlapping priority neighborhoods. So it made a lot of sense for us to work together. So I'd like to spend a few minutes left looking at some of the relationship risk factors between diabetes and cardiovascular disease. The American Heart Association considers diabetes one of the 7 major contributors to the risk factors of cardiovascular disease. People living with type 2 diabetes are 2 times more likely to develop and die from cardiovascular disease, such as heart attack, strokes, and heart failure. Diabetes is treatable, but even when the glucose levels are under control, it greatly increases the risk for heart disease and stroke. People with type 2 diabetes and some of the other following conditions are more at risk for developing cardiovascular disease. So let's go through some of those overlapping risk factors. So hypertension or high blood pressure. High blood pressure is a major risk factor for heart disease and stroke. Hypertension can contribute to stroke, kidney failure, coronary arteries disease, heart failure, and preeclampsia in pregnant women. Studies have found a link with high blood pressure and insulin resistance. So high blood pressure and diabetes combine to further increase the risk for cardiovascular disease. Abnormal cholesterol and high triglycerides. People with diabetes often have unhealthy cholesterol levels, including high LDL, which is the bad cholesterol, and low HDL, which is the good cholesterol, and high triglycerides. This often occurs in patients with premature coronary heart disease as well. In diabetes, insulin resistance is a condition that's called diabetic dyslipidemia. So these factors can contribute to both conditions. Obesity is another condition that increases our concern for diabetes and cardiovascular disease. It is a major risk factor for cardiovascular disease. It's strongly associated with insulin resistance as well. Weight loss can improve cardiovascular disease risk and decrease insulin concentration and increase insulin sensitivity. So obesity and insulin resistance have been associated with other risk factors, including high blood pressure. Lack of physical activity. Physical inactivity is another modifiable risk factor to decrease insulin resistance and cardiovascular disease. Exercising and losing weight can prevent or delay the onset of type 2 diabetes, reduce blood pressure, and help reduce the risk for heart attack and strokes. Any type of moderate to vigorous activity is beneficial, such as involving sports, housework, gardening, or walking. The American Heart Association recommends 150 minutes of moderate or 75 minutes of vigorous activity each week, and 2 muscle strengthening activities as well. And this is a cumulative effect. So you can walk 10 minutes in the morning, 10 minutes at noon, 10 minutes in the afternoon, and those 30 minutes all contribute to your 150-minute weekly goal. So it's not like you have to go out and do 60 minutes all at one time. You can spread it out and take it in small pieces. Poorly controlled blood sugar is another risk factor for both conditions. Diabetes can cause blood sugar to rise to dangerous levels, and a high level or out of normal range blood sugar can increase the risk of cardiovascular disease. Medication may be needed to help manage your blood sugar if activity or weight loss is not controlling it. And smoking is another risk factor for both conditions. Whether or not you have diabetes, smoking puts people at higher risk for heart disease and stroke. You can learn how to kick the habit, both quit vaping and quit smoking, through this website at the American Heart Association. You can also access the quit line through the Indiana Department of Health. In conclusion, people with insulin resistance or diabetes and one or more of these risk factors noted are at even greater risk of heart disease and stroke. People with diabetes may avoid or delay the development of heart disease and blood vessel conditions by managing these risk factors that we've discussed. The healthcare team will do periodic testing to assess whether you have developed any of these risk factors associated with cardiovascular disease. The iHeart community health workers are active in doing blood pressure screening and risk factor screening. More resources can also be found at No Diabetes by Heart in managing type 2 diabetes and heart risk. And here are the various resources that I use putting this information together, and they're also available if you'd like further information. And thank you very much.